কারণ আমি সাংবাদিকতা করি।
সেখানে হলে হতে পারে
না, সেটা আপনি ধরেননি।
May I now request Mr. Neil Simon, President of the American University of Antigua, and a key person that helped make this possible, to join us on stage.
But first 24 minutes, first 1 hour, first 24 hours is the crucial time where you can save the lives. My friends has traveled all the way from America to come, give some of the tidbits, some of their experience, share this with the Calcutta police, and that is the reason we are having this exercise. Thank you all for coming. We welcome all of you.
This country, especially of West Bengal, and it's such a great initiative. It was so heartening to know that, you know, Kolkata is number 13. I mean, we don't want to be number 1 in this, I'm sure. And yes, I think it's going to save so many lives. The ones who have left, yes, they have gone. Maybe with your training, many lives could have been saved then also, but it's never too late. And we welcome you, and it's a great initiative. And Dr. Chaudhary, I've had the honor of sharing the stage and an award with him in New York, and I have done nothing compared to what he's doing.
Really an honor to be associated with life saving, and traffic accidents are increasing in geometric progression these days. I think the main reason may be not because of rising amount of vehicles, but rising amount of ignorance which is causing these deaths. The Kolkata police very well knows that I think this initiative is absolutely essential, and I'm thankful to the people who are here, who are going to give us a little bit of training for CPR, who are poor in our country, have not had proper education, and they do not know what give way the triangular sign means. They don't know. No free left or no infiltration left. This is what they don't know. What does a broken line, what does an unbroken line on the road means? And all that they know is they have to stick their hand out and say, I'm turning right. And do that to say that I'm turning left. So with limited knowledge, you run the risk of having a lot of accidents. So I think as doctors are playing an important part here, the police need to take an initiative too, and educate the drivers. Otherwise, if we say that the minimum qualification for giving a driving license to a driver is Madhyamik or high school, then most of the drivers in India are going to go. I mean, they're going to lose their jobs.
My police friends, the students, ladies and gentlemen. Yes, it is indeed a pleasure for all of us to have these type of seminars in our city. And I thank K.P. Chaudhary for organizing this event here. Because more and more we interact, we gain knowledge. And we don't claim that we have enough of experience, because we have to learn more and more how to save life during the accidents. And it is true that the first person who reaches the spot after any road accident is the police people. They are the first to come for the help in the road. And if they learn the primary how to handle the situation, if they learn the healthcare system, primary healthcare system, how to tackle that, it will be beneficial for all of us who are there in the city. And I would like to say that the KPC has just said that we are 13 in the road accident and death cases. And with the vigorous campaign of Safe Drive, Save Life, it was beneficiary for all of us. The state has reached around 40% less what it was there in 2010 or 2011 because of this vigorous campaign of Safe Drive, Save Life.
And you know, these are statistics. Not in America, not in Afghanistan, not in Iran, not in Pakistan, etc. India is the first. India is the first. In case of IED blast, bomb and IED blast, yes, this is the figure. And when one IED or bomb exploded, temperature, you know, goes up to 3000 degrees centigrade. And if here one IED is blast, then one chair goes 10 kilometers per second. This chair, where the guest of honors are seated, so this is the enormous pressure released when a bomb exploded. And the person who just nearby of the incident, they just blown up, and rest of all the peoples are affected badly by the cardio knowledge of this CPR technology. And for that reason, CID bomb squad, the 25 touches will take part to have the use of this CPR technology. And I belong to that bomb squad. Thank you so much.
The workshop today, what is this for?
The training that we're conducting today is first aid in CPR with the police officers here in Calcutta.
And what are you training them? About what? In case of accident or?
So the objective of the training is to instruct first responders on cardiopulmonary resuscitation. That means if a patient or a victim stops breathing or they go into cardiac arrest, we're teaching them the steps as to what they would need to do to try and resuscitate the individual. It's applicable around the globe. And what we're trying to do is even more so raise awareness so that persons understand the importance. So you asked the question earlier if it's just for accident victims. No, it's not just for accident victims. It may be a trauma case, or it may be a young man or a woman in their home who goes into cardiac arrest and needs to be resuscitated.
So this is only for the cardiac arrest?
This particular workshop is focusing on, as I mentioned, cardiopulmonary resuscitation, which involves both the heart as well as the lung. Thus far, it's our institution, which is both the American Heart Association, the American University of Antigua, as well as API, which is the American Association for Physicians of Indian Descent.
Okay, and along with the Kolkata Police,
Correct, along with Calcutta Police and, as Dr. Lewis mentioned, KPC, the hospital here in University.
So how do you feel after training them? Are they capable to get this training?
Your first question was how do we feel? We feel tired, but overjoyed and very privileged to be